Welcome to NY Cosmetic Surgery Podcast, where we dive into the latest innovations, aesthetic insights, and inspiring stories. I'm Dr. D, NYC cosmetic surgeon. Thank you for connecting with us. Today, I'm thrilled to welcome to our podcast Dr. Claudia Kim.
I'm so happy to be here and thank you for having me.
Dr. Kim is a cosmetic surgeon in the center of Manhattan. We actually have some sort of history. We shared the same mentor, right? Dr. Karlinsky. So,
Dr. Danovich, you've been her first fellow. So you started this whole historical legacy of Dr. Karlinsky's and her training of surgeons into the field of cosmetic surgery. So it's always nice to be able to meet or to get to know a fellow, right? A co-fellow.
Right. So it was such an experience, actually. And I always call her, and first thing I say, you know what? Victoria, I'm so grateful that I met you. It has been very great start because at that time I was kind of not sure, am I gonna go into cardiothoracic surgery, plastic surgery versus concentrate on cosmetic surgery. And my husband, Dr. Anders, said, hey, you have been in training forever. He is cardiothoracic surgeon. And he said, of course, you can embark for another 4 years of training, but I have seen you operating. You're so talented for small things, make everything perfect. I see that artistic approach in surgical procedure. Why do you need to waste your time on going to plastic surgical training 3-4 years and do something which you will never do? So I know it's hard, like cosmetic surgery. What is your input on challenging aspect of cosmetic surgery?
So I think there's always been this discussion of what is cosmetic surgery and why is that different from plastic surgery? And cosmetic surgery is only a small part of plastic surgery, which people, use that umbrella term for cosmetic surgery. But in the plastic surgery field, there's microvascular, there's reconstruction, and there's hand, which is not really aesthetic medicine. And a lot of training programs for plastics, they don't teach that aspect because you're mostly in the hospital for training. And so with cosmetic surgery, we are 100% aesthetic medicine, right? So these are patients, we may do some reconstructive work, but that's not the main, the specialty of our field. And so I think it's really important for patients to know that cosmetic surgery is all aesthetic medicine and to really differentiate that. And it's funny that you mentioned that when we are pursuing our additional fellowship and specializing our training, I have a similar story. So general surgery, when it's coming to the time to apply for fellowships, my other alternative was trauma critical care. And I have my personal reasons for why I was deciding between plastics, cosmetics, and trauma critical care. And so it was an interesting story with Dr. Karlinsky was her current fellow was one of my senior residents. And he had contacted me to do a rotation. So I have done a rotation with her when I was a fourth year resident. And so he had contacted me when applications were going in. And at this point in time, I had a lot of trouble deciding between the three specialties. And so he pretty much was, Dr. Karlinsky wants you as the fellow. Why are you not applying? And so that kind of steered me towards that. And I'm so glad I made that decision. I have zero regrets in choosing the path that I did.
You joined Dr. Karlinsky right after fellowship, and now you are an owner of New Look, New Life.
Correct.
What is the difference between when you start as a partner versus you are on your own?
So it was a very special situation because when I graduated fellowship, it was the peak of the pandemic. And so it was just absolute chaos. There was that uncertainty about whether there was going to be enough cases, right? There were so many unknowns. And so even before the pandemic had officially happened, she had already asked me to come on as an associate. And so my contract was already signed. And so there was that uncertainty of what's going to happen. And then the pandemic hit, and then the office closed. And right before my contract was due to start, she actually decided to go down to Florida because we have two existing practices in New York, one in Manhattan and one in Westchester. And so she had decided at that point, I'm going to go start a third practice in Miami. And so she said, as you come on as an associate, take care of the New York practices. You will be medical director. So that was a huge, very unique situation. Not a lot of graduating surgeons have that kind of opportunity presented to them on a silver platter. So it's a huge honor. I guess that's a testament to how much trust she had in me as a fellow. But the pandemic was probably one of the biggest things to happen during for cosmetic surgery, as you well know. And it was chaos because everyone wanted to do surgery. This was a point in time when people were at home working. They had all of these extra funds that they weren't spending on vacation. And so cosmetic surgery exploded at this time. And so it was a very unique and challenging time, but it got me running, hit the floor, run, and haven't stopped since.
Wow, that's awesome. Because I started my practice from GET. I opened my new location and started practicing on my own. I did not have partner. You know, sometimes you need support, especially in the beginning.
Absolutely.
You need support, just a shoulder to lean on. I could always call Dr. Kalinsky and ask her for sure for advice, but I did not have that particular support. I didn't need to answer to anybody, which is a huge plus. But at the same time, it's challenges as well, being independent. What is your input on patients from other surgical specialty in our patients? Because this is just cosmetic enhancement, they do not take it as seriously as they should. They simplify. Oh, I still have pain post-op day number 2? Really? They come in on day 5 after major facelift and blepharoplasty and brow lift and upper lip lift. Say, oh, I'm still swollen. They simplify. They simplify the intensity of procedures.
Absolutely.
Even though our procedures are cosmetic surgical procedures, but they kind of like omit word surgical. It's still surgery and big time surgery, full blown surgery. But that's what I am facing those particular challenges when I have to actually dissect and bring down to the point of how important it is to look at it as a major recovery and kind of like settling expectations.
I think the psyche of the patient is, yes, if it's an emergency and you need your gallbladder taken out as an emergency, pain is expected. But if I'm doing an elective procedure as like a tummy tuck, why am I uncomfortable? And I feel like our patients do need a little extra support, right? And so, especially since we run like a very boutique practice, right? The relationship that we have with our patients is much stronger, right? So in the hospital, when we take out a gallbladder, there's not much interaction and there's not much, consoling of the patient, versus here, we are there for them. So I feel like they might have that comfort of being able to let us know of their discomforts, versus in the hospital, they don't really get a chance to tell the doctor.
Right, that's absolutely right, because personal care is a completely different level. So, for sure.
One thing that Karlinsky has always drilled into my head, and I'm sure she said to you as well, is always under promise, over deliver, right? These words will haunt you for the rest of your life. And I think it's so important to have that expectation with the patient, and you tell them every single little thing that they're going to feel and possibly feel, and make it so that they understand all the worst things that can happen. So when it doesn't happen, you're fantastic, right? You did a great job. You tell them you're going to be very uncomfortable, everything's going to hurt for like X amount of days, and when they're not, they're so happy. But it's expectations.
Absolutely right approach. It saved me a lot, have saved me a lot, and I think for our or new cosmetic surgeons or new physicians actually is the best way to embark in this particular very competitive field.
Absolutely.
So, what would be message to new cosmetic surgeons coming out?
So from my experience is that patients can tell when you're not being genuine, right? You can be nice, you can be polite as a provider, but if you have true passion and compassion in taking care of patients, it emanates from you, and patients can tell that you're being genuine. So if you hate what you do, and if you hate interacting with patients, and you can't deal with the difficult situations and the complicated cases, don't do this, because you're gonna have to deal with it. And patients will tell when you are annoyed, right? Or if you are just, just tired of their nonsense, they will know. So be genuine in what you do and how you say it, right? I think that's very important for new surgeons, because you have to understand that because this is an elective specialty, they have so many other options that they could have chosen, but they chose you, whether it be due to your skill, whether it be your friendliness of your staff or the cleanliness of your office. For whatever reason, they chose you, and that is an honor, okay? So you have to show them that respect and be humble.
I completely agree. My husband is a program director for general surgical residency, and I have interacted a lot with residents, current residents, and how they think is that they choose specialty and subspecialty based on lifestyle. They think, for whatever reason, that cosmetic surgery is going to give them great lifestyle, easier lifestyle. What do you think about that?
There is some truth to that, obviously, because since we don't have to take hospital call, yes, our lifestyle is more comfortable, I do agree, but that doesn't diminish how much work we put in, because even though we have specific office hours, our work continues, right? So as you know, patients will contact us in the middle of the night if there's a question, if there's an emergency, and that is something that we have to address. And especially if you're in a solo practice, it's on you. And recently I had gone away for the weekend, and there was a patient who I had operated on, and they had a hematoma. So what do? You have to come back. And if you're lucky enough to have an associate that's covering for you, great. But sometimes you may not. And so your patient, just because your office hours are from 7 a.m. to 7 p.m., if something happens, it's on you.
Exactly. Like, I am a solo practitioner, so thanks God I have PA who is excellent, taken care of a lot. But at the same time, if something happens, you have to go back. You have to get up in the middle of any dinner or engagement, holiday parties, and you have to go. Because sure, maybe when you join to a huge group of cosmetic surgeons, everybody takes calls. But if you're a solo practitioner, I think lifestyle is not that greatest. I have to tell you, especially when you operate a lot and you have a lot of post-operative patients with their certain expectations, and you have to, they require attention. They require babysit more than in any surgical specialty and subspecialty. They take out gallbladder, and you're lucky if you're gonna see your surgeon once.
In clinic.
So, but in our case, we are boutique practices. It's a different, completely different mentality and approach and philosophy. So maybe lifestyle a little bit better in terms of we're not taking calls, but at the same time we're always available for them. So you mentioned absolutely correctly that if you love something, it doesn't matter what kind of lifestyle you are embarking on. You just love it. That's fine to get up in the middle of the dinner and go, because you truly love it, you care. That's what I always say. If you want to select specialty based on lifestyle, it would be completely disappointing.
Because especially if you do have a solo practice, it's not just the patient care that you're worried about. You're worried about the administrative aspect of it, right? So the whole picture. It's not just operating, see you later, and that's it. There's so much more that is behind the scenes that you are responsible for. So depending on what kind of practice a graduating surgeon is seeking, it differs, right? Yeah, but then again, if you are in a group practice, you may not have that much liberty and as much decision-making potential as if you were a solo practice. So everything is going to seem different, right? From behind the fence, everything seems different or greener, but everything has its pros and cons wherever you go.
Absolutely. As I mentioned before, my husband is heart surgeon, but he's doing more so lung surgical procedural oncology, lung cancer, esophageal cancer, and I have to admit he has better lifestyle than I do. So he has like 3 partners, and pretty good lifestyle, nevertheless. I'm on call, text messages, and but he's on call, fine. He's on call. If he's not, he's not. So that's pluses and minuses and everything, exactly right.
When you're in, you have like a set call schedule. You sign out, right? You sign out, and then it's on their hands, right? And then when you come back on, you take on the same responsibility. So when you are off, you are truly off. Well, here,
when it comes to business aspect of the practice, if I only operate, I would have nothing to do. As soon as I come out, right, I have marketing consultants texting me or email me. I have to sit down and check how is my advertisement doing, how is my social media. Then I have to record on TikTok, and then I have to record this and that and something else. I think it takes good 50%, if not more, if you are in private practice. And how many plastic cosmetic surgeons we have to compete?
Exactly. And obviously, you know, there is a vast demographic of patients. Some patients will choose one type of practice, which is, you know, less hands-on, but more financially in line with their needs, right? Versus patients who are looking for some more support. So in those individuals, they expect a certain level of service, right? Because of the premium that they pay. And so you have to make sure that you are satisfying their needs in an appropriate manner while you're handling all the other business aspects. So it's tough.
It's very tough. And you learn every day, because this kind of aspect, business aspect, we did not learn in medical school. And that's biggest challenge. So every day, something new, it's just so dynamic. So you have to catch up every day. Being a female, do you think is it advantage or disadvantage?
It's an absolute advantage. Oh, we are so lucky to be females in this industry, which is kind of a flip, right? Because during general surgery, right, during your primary specialty training, especially, you know, general surgery, it's a male-dominated field. It has been getting better in the past, you know, couple of years, because now there's more female medical students that are entering into schools and thus filling these specialties. But historically, it was always very chauvinistic, right? Very male-dominated. And so as a female surgeon, I don't know if you've had experience, but you will experience some discrimination, right?
Big time.
Discrimination, sometimes a little harassment, you know, sometimes taking things a little bit too far. So it's always challenging. And so I think because of those challenges, female surgeons are notoriously become like a hard bitch, right? Pretty much. Female surgeons are considered like very tough, and they become a little jaded. However, in cosmetic surgery, that is our asset, right? Because I would say my patient population is probably about 60 to 70% female with, you know, 30%, somewhere around there, of males. But as a female, I think you can definitely sympathize and relate with your patients, the majority group of your patients. And I think there is that trust.
I have heard surgeons saying, I'm just a surgeon. I don't care. I don't care. Medical doctor can manage medical aspects of your issues. I'm just a surgeon.
But you're general surgery, though.
Right.
Because general surgeons are very different.
Right.
Because we, in the hospital, we had patients admitted to our service. We were their primary service. So we were the ones responsible for managing hypertension, diabetes, in conjunction with their surgical problem. Right? So we don't call consults for how do you manage this person's blood pressure medication. We had to do it.
Exactly.
So I think general surgeons, we are very different because we know something about everything, because everyone has something in the hospital. Exactly. So I think because of our primary specialty, we're wired a little differently.
Exactly. And who are the best residents in the house during the call?
The general surgeon.
Exactly. We can handle all. Exactly. We can manage blood pressure. We can put central line, chest tube. So if nobody can get vein, we will.
Absolutely.
So, exactly. So, and this particular mentality carries us through whole career, I think. So we can just, for example, if we are gonna encounter, and complications happen to every single surgeon. More you operate, more complications you're gonna get.
Absolutely.
Regardless how careful, sometimes it's just unpredictable. And if complication happens in my head, I have to be able to take care of in the OR at least 95% of issues. Otherwise, who am I? One very interesting aspect, what I always say to my patients, if you're not sure, I strongly advise you to have second, third, and fourth opinion. Because if you choose me, you have to be 100% positive that I am the best, I am the one. Our practices are cosmetic surgical practices, surgical and non-surgical, but we are not a med spa. No matter what. And I'm going to touch a little bit of politics right now. Every single plastic surgeon, for whatever reason, and I don't understand why, they have something to say. And I'm not competing with them. I never said that I'm plastic surgeon. I never wanted to be a plastic surgeon. Why? Because I knew that I was planning to do the cosmetic procedures. Plastic surgical residency fellowship will not get me that training. And I would like you to explain to our audience, what does it mean that training, plastic surgical training versus our training, cosmetic surgical training? What is the main difference?
So plastic surgery entails multiple things, not just aesthetic medicine. If anything, aesthetic surgery is a very small part of their training because the majority of their training is usually in the hospital, right? So hospital patients, you're going to come with emergencies like traumas or hands, microvascular reconstruction. And so from the other plastic surgeons who have undergone their training, and I've as a general surgery resident, I've been on plastic services, right? And so with all the things that I've covered, I saw maybe one breast reduction out of the 3 years of when we were covering the specialties. So you're not doing you have very little exposure to cosmetic surgery, but people don't understand that. The majority of the training is, again, all these other stuff. And so this is from my interactions with other training fellows and surgeons, is that they didn't actually start practicing cosmetic surgery until they graduated. And then they end up joining a practice. And then once they're part of a large group, that's when they're starting to do tummy tucks and breast reductions. So meanwhile, my entire training, I've been doing these nonstop. I graduated with 600 cases in 1 year, right? They don't see that volume of cases until several years into practice as an attending.
If they're lucky.
If they're lucky. And so, yes, I was fortunate because, again, my training was during the pandemic. And so since I was super busy, but just that sheer volume of exposure means that you are miles ahead than of another plastic surgery graduate, right? Not to say that we will eventually catch up, but just right off the bat, we have only exposure to plastic or cosmetic surgeries or cosmetic cases. So that is big difference.
And if you notice, majority of plastic surgical offices or practices, injectors predominantly are NPs or PAs. So they very rarely inject. So that also stems from their training on that non-surgical aspect of our cosmetic practices.
And depending on what kind of training program that you're in, there are different cosmetic surgery practices which are predominantly only surgical, right? Versus some might be a mix, like that's my current practice, and we do have a fellowship program. We are both the non-invasive or the less invasive, and then we have the invasive surgical aspect of the training. So there's wonderful PAs, there's wonderful aesthetic nurses that are able to do it, but yes, sometimes you may not have that kind of experience as a graduate immediately too, until they have some practice and they have exposure to it. And again, some plastic surgeons, they don't do it at all because they have a secondary provider doing it for them.
Exactly. Everything stems from what you feel comfortable doing. So they had extensive training in reconstruction. They had extensive training in other things. And when they join group, and usually they join big group, so first 10 to 15 years it takes for them to just do some small things for senior partners until they catch up. That's fine. Why to just discriminate? No reason to. So I started my practice Of course, it was a huge investment on top of everything else, that you are alone without partners and you rely on yourself without any extensive support. So, but everybody can do it. Also, when people try to cut corners and look for some sort of easier start, for example, plastic surgeons, when they come out from fellowship, they can put themselves on call, take calls in the ER, be hired by the hospitals, have position. So they can generate income from that, and pretty good income. When I started, I only invested into my business, invested in, and usually it takes good 5 years until you feel like, now I can get something out of business. While they already, for 5 years, they generate income. They pay their loans, they enjoy their life. And then when I start enjoying my life, they start hating on me. So not fair, not fair. So and I truly believe that you are the best what you do more often. So if you do abdominoplasties on a regular basis, you're good. You are better than anybody else. So if they do randomly here and there, and so
the nature of this age-old fight between plastic surgeons and cosmetic surgeons. I think probably because obviously, well, I won't speak for all plastic surgeons, but doing the cosmetic procedures is more lucrative, right? Because it's not, most of them don't go through insurance. It's a different type of medicine that they can provide. Not always, but I feel like maybe they believe that cosmetic surgeons might be impinging on that ability of theirs, which it doesn't, right? Because
it doesn't.
We have so many patients that are looking for the right fit, right? Just because you provide that procedure doesn't mean that you are the right fit. As much as they are interviewing us, we are interviewing the patients. And so just because this patient wanted surgery doesn't mean that they're going to choose you or they're going to choose me. So it's not like a fight. It's not a competition. If anything, we can be supportive, right, to each other and have this community. But I think we made some headway because of the AACS, the American Academy of Cosmetic Surgery, has been dealing with our concerns. And so according to the AMA, cosmetic surgery is now an equivalent specialty.
Exactly.
And so to get that recognition is huge for us, because there's all these political figures trying to suppress our representation. And so now we're getting the representation that we deserve.
Exactly. It's my painful topic because that's our philosophy. Our academy's philosophy, that we should support each other. We should celebrate each other. Your patients are not gonna be my patient, but if they are, fine. That's what I said. When patient comes to me, I conduct consultation. I encourage them to go and see you or surgeons like you, and if she or he likes you more, I'm gonna be happier for her because that's better fit.
Absolutely.
It's not like I will never feel like I lost an income or I lost patient. I feel like I gained some trust. So
I completely agree. I have no problem saying, if the patients are like, oh yeah, I was like, see all of them. Whether you like me or not, go see all of them. Because again, you're interviewing the doctor and the doctor's also interviewing you. And it has to be a right fit and it has to click, right? And so go and see, because maybe you are looking for something that I cannot offer you, or it's just not in line with what I envision. And so you need to find, as a patient, someone who shares your vision. And something with the Cosmetic Surgery Academy, we are very welcoming. I've never seen an association like ours, right? You can have these huge pillars of the industry, right? Big time grandfathers of surgery, and you see them speak. They have no issues with you emailing them or coming up to them and asking them a question. Everyone is so welcoming, because we really do want to raise each other up as surgeons, which I think is not always universal across the different, academies or associations. But I am so proud that we are the way we are. Maybe it's because we have this humility, because we've been fighting for so long, that we just want all of us to succeed as a whole.
I think we're more human. We are more, and I have to tell you, if you call me and say, hey, I need help, I'll drop everything, I'll help. Because, as I said, we're here to support each other, to help each other. I have questions, and I hope that the same applicable from my end. I can share my secrets, my insights, my expertise, or my experience in certain things. And I'm gonna be proud if you are gonna actually adopt them.
So there's that saying, right? There's that famous saying, smart people learn from their mistakes. Truly wise people learn from the mistakes of others. And so if you are teaching, right? Teaching, I would love to make sure that my mistakes are not your mistakes. And I think that that openness and that mentorship is very strong in this specialty across the surgeons. And so I'm so proud that we are the way we are.
Yes, and every time I go to Cosmetic Surgical Academy meetings, annual meetings, I'm so inspired. And this is to see that support from big-time surgeons. It's absolutely invaluable. It's just amazing. Just nobody is nagging you. Nobody is looking down on you. They just want you to be successful as they are, and even better.
And because, again, we have that understanding that we're not trying to steal your patients, right? There's enough patients to go around. It's just let us all be successful together.
Exactly. So. Exactly, and some patients I cannot handle, and I know she would be great fit with you. Why should I get this patient, make my life miserable, make her life miserable? Hey, our limitations are our limitations, and patients' safety and happiness, satisfaction should be always on top of everything. That's why we have to support and share our ideas and on a regular basis. That's how our philosophy stems from Cosmetic Surgical Academy. That engraved in us.
And I think it's also, no matter how long you've been doing this, there's always room, there's always something new to learn, right? You are never gonna be so obsolete that you know everything. There's always going to be someone who knows more than you and knows how to do it better than you, right? So when you have this closed-mindedness of I'm the best, I don't need to do more, I think that limits your ability to evolve as a surgeon. And so I have my fellowship program. I love it when they call me and say, hey, I have this complicated case. What are your thoughts, right? And sometimes I learn from my fellows. Right? Because just because I'm their fellowship director doesn't mean I know everything either. And so when they bring in and they say that, oh, I worked with this other surgeon, or what do you think about if we did it this way? You're always going to learn. You're always going to evolve. And that's what makes you a good surgeon, is being open to evolving, right? And you cannot stay stagnant, or you're just going to be left behind.
Exactly. As per Darwin's theory, if we're not evolving, we're becoming dinosaurs in no time. So I think we covered pretty much. So Claudia, thank you. Thank you for taking your time, for sharing your insights and expertise on the cosmetic surgical arena. And thank you, our listeners, for joining us today and always. Please do not forget to subscribe, rate, leave a review. Remember, 5 stars are very important to us. Please consider giving us only 5 stars on Apple Podcasts, Spotify, or whatever platform you listen to us. Please follow us so you don't miss the episodes. Also, don't hesitate to ask and give us your feedback, because your questions could be the next topic for our episodes. We greatly appreciate your commitment. Until then, stay curious, stay inspired, and keep pushing forward.